फ्रेंड्स, वेलकम टू माय त्वचा। हम लोग डॉक्टर अर्चना कदम के साथ सेगमेंट कर रहे हैं। हर पैशन इज अबाउट चाइल्ड डेवलपमेंट, सो टुडे वी आस्क हर अ वेरी क्रूशियल क्वेश्चन। डॉक्टर, एक वर्ड बहुत ऑफन सुनाई देता है डेवलपमेंट के बारे में, इट्स ऑटिज्म। तो वो एग्जैक्टली क्या है और उसके लिए पेरेंट्स को क्या ऑब्जर्व करना चाहिए?
Okay, now see, autism is a developmental condition wherein बच्चे के जो social skills हैं, communication है, play and sensory issues, there might be difficulties in these areas.
Okay.
Whereas in other areas, the development either might be progressing well or there might be delays. We call it as an autism spectrum because every child is different. But the main thing is that the child's social milestones, communication milestones might not be going as per age expectation.
Okay.
So some red flags for communication: if the child is not using word with meaning by 15 months,
Okay.
if the child is not pointing to what he wants, if the child is not following the mother's point, mama is pointing and he is not looking at that.
Okay.
If the child is not joining words by 2.5,
दे दो, पानी दे
बॉल
दो।
दो, पानी दो. If the child loses language, कभी कभी कैसे रहता है कि बेबी पहले बोल रहा है, मम्मा बोल रहा है, पानी बोल रहा है, and then later he stops doing it. This is a red flag for language. सोशल स्किल्स में कभी कभी बच्चा बिहेवियर से चीज़ें मांग रहे हैं. हाँ, नहीं मिला, नीचे लेट गया, हेड बैंग किया और उसको मिल गया.
That's true. That's true.
Sometimes the child is not looking at the parents so well, so eye contact is something. The child is not responding to me. These are red flags for development. Play में imitation skills बच्चे के एज के हिसाब से नहीं रहते हैं sometimes. So हम समझो गाना कर रहे थे तो बस रिमोरा, and the child is not copying that. The child is not copying the gestures. He is not filling in words.
Hi, bye, जो बेसिक है.
He's not sharing, he's not enjoying. Sometimes they have sensory concerns. So normal sound might be overwhelming. He'll cover his ears, or he'll like to spin around himself. He'd like to do jumping. These are some red flags. But just because we've noticed this doesn't mean your child has autism.
That's true.
Your child needs to mention your concern to your pediatrician and get a screen done on your child.
Okay. So basically just an observation which can help you to understand it's normal or it needs an intervention.
Right, and our job is to start work early. We are not bothered about a label. Start work early and have functional gains. That's more important.
Wow. Dr. Archana, type of delivery does have any effect on autism or any kind of a developmental issue?
Actually, there are no studies proven. It's multifactorial. Many etiological factors talked about. Nothing pinpoint.
Okay.
So it's really difficult. You know, is it because gadgets लेके बैठा है इसीलिए हो रहा है, इसी मैंने बात नहीं की है उससे? It's very difficult to answer this, but most of the times, lot of tiny changes that we bring about in the way we interact can make a huge impact.
Oh, that's important. The last question, with respect to the child having an autism issue or any issues like this, will they observe it's genetically also? In case anybody is there in the family, should it be seen very early with a developmental pediatrician or spoken to doctor?
As I said, multifactorial. You
That's
don't
true.
know the cause. Sometimes it could be genetic.
Okay.
If one child has autism, with the second child, we'll do high risk screening. We'll see the child
That's
more
true.
often to be able to identify early markers. It's not that matlab if one child has the other will have. No, it's not like that. 5 to 10% risk. But genetic cause for autism is found in very few children.
Okay.
So,
अगर है तो एक बार दिखा दो.
agar if one child has autism, you could do genetic testing and
Okay.
counseling before you plan for the next child.
That's very, very important for all of you parents. Just understand that the autism concern, again the way she said, picked up early, it can definitely help. Thank you so much all of you. Have a great time. See you all in next segment.